Welcome to another live question and answer with Tustin Longevity Center. My name is Talon Ellithorpe. I am the practice manager here at Tustin Longevity Center. I'm joined by Dr. Rita Ellithorpe, our medical director and founding physician. And we're here answering your questions. We're talking about current news and things that are relevant. Obviously, COVID-19 has been the hot topic lately, but we welcome any and all questions. It doesn't have to be COVID related. It could be general health related. We are an integrative practice in Tustin, Orange County, California, and we are here. We're open. We're seeing patients. We have same-day appointments available. We're seeing patients still in office live as well as telehealth. And if you don't know, we're able to now bill those visits to insurance just like a regular office visit. So we're encouraging our patients to continue with their regular checkups. If there's any acute concerns for illnesses or prevention, we really specialize in keeping people's immune system strong. We're going to be talking a lot about that today. But I can't encourage you guys enough. We want this to be an interactive event. So look for the chat section next to this live stream. Post your questions there, and we'll be answering those questions as they come in. So doctor, how are you doing today?
I'm blessed, thank you. I'm doing very well.
Awesome, I'm as well too. Just checking here, it looks like we are already getting some questions, and you want to just jump right in, or did you want to start with
Go ahead and start with a question, because the idea here is we started this all to help our patient base get a reference where they could go to YouTube and get some simple answers and save on some of the clutter of the phone calls. And we're here to try and help our patient base, and if this helps other people, that's a blessing as well.
Absolutely.
It's not meant to be personal medical advice. It's designed to be what we're doing as integrative physicians. So
Absolutely.
We'll start with
And do us
that.
a favor, if you're finding value with these live Q&As, let us know by liking the video, or even better, subscribing to our channel. That way we can continue to reach people, we can continue to gain traction and see if this is working, if this is connecting with our audience. So please like us or subscribe to our channel as well too.
Yeah, I don't know too many doctors that'll put themselves out there for any question in the world. So if I don't know something, I'll look into it and try and get back with you.
Yeah, and now's your chance. We do this every Wednesday, 9:45 a.m. Pacific until about 10:15 Pacific for half an hour. We take any questions. So you do not have to be a patient here to ask us your questions. So if you have family members, friends, loved ones that have concerns or health issues, again, this isn't meant to replace medical care, be specific medical advice, but encourage them to come on and ask their questions, and we can help steer them in the right direction. And again, we are doing telehealth visits as well too for both new and existing patients, so they can always schedule an appointment with us as well too for specific medical advice. We'll jump right in because I see we're already getting a question here. If I'm a patient of TLC, will you care for me if I get the virus? Will you write scripts if I choose to stay home? If not, where should I go?
Well, the whole deal here is trying to prevent you from getting sick to the point where you would need prescription for hydroxychloroquine or azithromycin and such. I don't do inpatient hospitalization, okay? So you would have to see the hospitalist at the hospital. But again,
that's assuming that they have to go into the hospital.
Correct.
Because a lot of patients that, let's say you're diagnosed positive with COVID-19, the coronavirus. Many patients, 80%-ish or sometimes even higher, manage just fine self-quarantining at home. And yes, absolutely, we want to be checking in with those patients, monitoring and maintaining their health remotely.
Correct. If you're listening to some of the data on the worldwide exposure to COVID-19 virus, it is starting to look like now we're getting a picture. These aren't absolute determinations, but we're getting the picture that the exposure is larger than we thought. So the denominator, the bottom number, is larger than we thought. Many people asymptomatic, carriers, or with very mild symptoms. And we have a better number on the top, the numerator, okay? And with that knowledge, we are clearly seeing that what the World Health Organization had initially concerned us with, a 3.4% mortality rate, was way up from what probably really is the reality. And my study over the past few days has been putting the mortality more at a 0.2, 0.3 And that's orders of magnitude much, much, much lower. So number one, I again want to say that if the doctor is trained in how to care for the patient's immune system as their basis of seeing the patient, then your patients are probably going to do very, very well, as all of our patients here have done.
Yes.
So yes, we are here to build up your immune system, and we're going to talk about that. And it's tremendously designed to deal with anything coming at us. You have to understand our gut has trillions of bacteria and yea, even viruses. Our whole body is exposed to these things, and we're well able to deal with this if you take care of yourself, and we're going to talk about those things. So yes, we'll take care of you. Yes, we can use the azithromycin and hydroxychloroquine. I've been prescribing that for my psoriatic and rheumatoid patients for many years. So it's no big deal.
Right, absolutely. Call the office and schedule an appointment with one of our providers, either telehealth or in person, and the doctor can have a specific conversation with you there. Next question. For several days, my wife has had a headache, fatigue, and a lot of difficulty sleeping. She has no temperature. What is a safe amount of melatonin to take to sleep better at night?
Easily 10 milligrams is fine. If you don't eat late because putting food in your stomach will interfere with your body's ability to say it's bedtime. You're going to be putting food in late, and your body is thinking you're going to use your body. Number two, be well hydrated. You don't sleep well if you're not well hydrated. Number three, melatonin 10 milligrams is very valuable. Magnesium, like 250 milligrams to a gram, is very helpful with sleep. Zinc, 10 to 15, 25 milligrams is helpful with sleep. 5-hydroxytryptophan is very helpful with sleep, about 50 to 150 milligrams. Ashwagandha, 150, 250 milligrams is very helpful with sleep. And so I would certainly try those things. Water, hydration, don't eat late, take 10 milligrams of melatonin, use some ashwagandha, use some magnesium, use some zinc, use some 5-hydroxytryptophan, and L-theanine is very, very valuable. We have a powder called OptiMag Neuro, which has the L-theanine in it and the magnesium. I often use that at night. We have the TLC Goodnight that has the 10 milligrams in it.
Melatonin and some of those amino acids.
And those amino acids as well. Lysine and L-arginine. Maybe people would argue L-citrulline, but lysine and L-arginine are also helpful for sleep.
Thank you. I am curious, what do you recommend for persistent headaches and constant back pain?
Well, number one, if they're persistent, you should be seeing a doctor and have a physician evaluate this. There are so many questions. How long, how severe, what time of day does it start? The issue with hydration is severe. Americans are not drinking enough water. You have to understand, when you come to see me, the very first question all our patients are asked are, how much water do you drink a day? That's our number one question. We are made of close to 80% water. We're little cells of sacks of water. And so to help repair, transmit, and remove waste, transmit nutrition, you've got to drink your water. And then enzymes, systemic enzymes are natural anti-inflammatories. So the timing of the headache, the length of it, it's got some classical indications that a doctor would need to know in order to make determinations on how to manage you. Most things are benign, but I would see a physician. I would drink half your weight in ounces of water. So if you're a 200-pound man, 100 ounces. If you're a 150-pound woman, 75 ounces every single day. Magnesium is a very natural relaxer for the smooth muscles. I would take magnesium, and that also helps with headaches. And then, of course, I would do stretching and some form of regular aerobic exercise for circulation. That would be my beginning point.
Thank you, doctor. What do you recommend regarding the disinfecting of groceries? I'm finding I'm driving myself and family a little crazy. Please provide practical, reasonable steps.
Well, I always use paper bags, and then I don't have to reuse them. I don't have a bag that I take with me. If you do, then you'll have to wash it if that's a concern for you. I am suggesting that you wash your hands, okay? Wash your hands, and and I've always done this, when you open up a can of anything, you put a little water on it and you wipe the top of it before you open it up. So I would not say that it's wrong to let the water go over it and with your paper towel wipe the top off of it. You can't do that with boxes of spaghetti and things like that. Right. I think you're overly concerned about this when we are realizing that the mortality is really much lower than what was originally so concerning to us, put out by the WHO in March. I think we're much too concerned. Hand washing, rinse the top of your cans off to open them, and if you're going to cook any pasta, that's going to clean it. Throw those away, wash your hands frequently if you touch the boxes, and use paper bags and discard them. And that's how I would approach it.
I'll just add to that. I recently came across a video on YouTube that was being talked about in a healthcare discussion group. A doctor went out and made a video. I believe he's based in Wisconsin. And he talked about your cleaning off your kitchen counter and creating, sort of like doctors do when they prep for the OR room, a dirty side and a clean side, and he had a piece of tape on it. And he laid all his groceries on one side, and then one by one he would move them over to the other side and wipe them down. So maybe I'll find that link if you want to be extra careful, because again, we're trying to keep people's immune system strong, and we're saying let's put this in perspective. Most people are dealing with this challenge just fine, but those people that are in the higher risk groups, perhaps you want to take a little extra care with the elderly or people with comorbidities. Then if you want to be that particular, then this I think was a great video. It was very quick and very kind of to the point. Next question is, how valuable is wearing a mask every time going out into public?
I think the mask is valuable in preventing you from touching your face. I think that's the main focus of it. And if you're sick and coughing, you shouldn't be going out, So really, the mask is designed to help you stop touching your face so much.
Okay. Next question is, what zinc do you recommend and how much?
Well, that's a topic I want to get to in a moment here. I'd like to bring up some information here if I could.
Sure.
I was looking into some of the pieces of information, and it sounds as if the word vaccine is coming up over and over and over again. And so, one of the biggest funders of vaccine development is, of course, Bill Gates. And Bill Gates was on the news on April 6th and being interviewed up in his state there of Washington, April 6th, by a Trevor Noah, and the news organization was KIRO 7 News out of Washington. And this was by Trevor Noah, and he said Bill Gates has been outspoken about how the United States needs to do more to get ahead of the pandemic. His foundation has already donated $100 million to fight the virus. But a vaccine, he says, Bill Gates, is the only thing that will allow us to return to normal. Now, one of the things they talked about, or Bill Gates talked about, was a woman by the name of Jennifer Haller received the first experimental vaccine made by a biotech company, Moderna. And the CEO, Mark Zussman of Gates Foundation, was talking about trying to fast track these vaccines. And he was stating their philosophy is we need to be ready to scale and manufacture that vaccine in literally hundreds of millions and billions of doses because it needs to go global when we have it. So that is what I'm hearing over and over again. Now, I want to point out to you that the Department of Health and Human Services, and this is published on the U.S. Department of Health and Human Services for February 4th, 2020, and the title of it is Notice of Declaration under the Public Readiness and Emergency Preparedness Act for Medical Countermeasures Against COVID-19. The summary is, the Secretary is issuing this declaration pursuant to Section 319F-3 of the Public Health Services Act, code blah, 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 to provide liability immunity for activities related to medical countermeasures against COVID-19. This declaration is effective February 4th. Now, it says, these liability protections provide that subjects to other provisions of the PrEP Act, a covered person shall be immune from suit and liability under federal and state law with respect to all claims for loss caused by and arising out of, relating to, or resulting from the administration to or use by any individual of a covered countermeasure if a declaration has been issued with respect to such countermeasures. And a covered person is defined as a specific meaning as defined in the PrEP Act to include manufacturers, distributors, program planners, qualified persons, and their officials, agents, employees, and the United States. And it just goes on. So this is the act right here. Now I want to point out to you, in 2002 we had the SARS-2. In 2002. We had the original SARS, which is the acute respiratory distress syndrome. And this was published in 2012 because they were looking for vaccines to it back then. That's 18 years ago. And on 2012, by the science organization PLOS1, for April 20th, 2012, the title of the article is Immunization with SARS Coronavirus Vaccines Leads to Pulmonary Immunopathology on Challenge with the SARS virus. So the background of this study is severe acute respiratory syndrome emerged in China in 2002 and spread to other countries before brought under control. Because of a concern for reemergence or a deliberate release of the SARS coronavirus, vaccine development was initiated. Evaluations of an inactivated whole virus vaccine in ferrets and non-human primates and a virus-like particle vaccine in mice induced protection against infection, but challenged animals exhibited an immunopathologic type lung disease. So the results and conclusions were these SARS-CoV vaccines all induce antibody protection against infection with SARS-CoV. However, challenge of mice given any of the vaccines led to occurrence of a Th type 2 immunopathology, that's part of your immune system, Th2 cells, suggesting hypersensitivity to the SARS-CoV components was induced. Caution in proceeding to application of a SARS-CoV vaccine in humans is indicated. Now this is just one paper out of many. So they've had 18 years to try and develop these types of things, and indeed maybe this was happening and it got released from the Wuhan level 4 lab. We don't know. But what I'm telling you is, before we start listening to a man who is not a doctor, who is saying our only solution is vaccines, you need to be made aware that these vaccines that have already been developed created tragic deaths in human beings already. 2 children died in some of the studies that I had reviewed over the weekend. And so we have to be cautious about thinking a vaccine is the solution or only solution. What we need to talk about is building up our wonderful immune system, which has been ruined in this country with a high carbohydrate, sugar, sweet, high fructose corn syrup. Monsanto purchased the patent to high fructose corn syrup. And this hurts our immune system, all our carbs. So if we're going to change anything, yes, go ahead and be more concerned about your hand washing and such. But you better look at your bread, your starch, your crackers, your pasta, your peas, your beans, your fruits, your juices, your cakes, candies, crackers, donuts, and latte, frate, hoppy lattes that we're getting with all the sugar in it. And then you better think about all the processed food you're getting that doesn't have the minerals in it. And my dear vegetarians and vegans who are trying to stay away from animal foods, which are some of the richest sources for zinc and these minerals that are so immuno-enhancing, they have to take extra measures to try and get these minerals in, because eggs have plenty of this in, as well as cell membrane repair components.
Okay, so just to get back to the question, what zinc do you recommend and how much?
Here is a proposal I suggest the news address and all of us. We are having shortages of getting vitamin C. We are having shortages of getting zinc. We are having shortages of getting certain components of enzymes and vitamins in general. And I suggest there be a study out there as how much vitamin C has been sold in the past 2 months in the United States of America. How much vitamin D has been sold in the past 2 months? How many zinc products have been sold in the past 2 months? And then if you look at those sales and the fact that our company is struggling here, our medical office, trying to have it for my patients, maybe the reason that we're doing so well, maybe the reason that we're flattening the curve could also be that we're building up our immune system and getting the defenses with the vitamin D and the zinc and the vitamin A and the B vitamins and eating a healthier diet and eating less carbs. Could that be it?
Could be.
It could be. So that question, you see, I'm a scientist too. We publish here and we need to look at all the issues. Now, I am not saying don't work on a vaccine, but I'm saying be careful, be educated, and we were designed to have this. So let's look at that question. Maybe the flattening is all the zinc we're consuming now as a people. So I've had to go and look for other sources of zinc. We have by Metagenics the Zinlori zinc, which is a 17 milligram per tablet. And so we still have this here as well. We have the Zinc Forte by Biotics, and this has 25 milligrams in one tablet, so that's a nice high dose one. We have the Viracid by Orthomolecular, and Viracid in this has 4 milligrams, but it has so much many other wonderful things such as the vitamin A, the vitamin C, the B vitamins, astragalus, elderberry, andrographis, echinacea, L-lysine, aerosola fruit extract. So this is a wonderful immune stimulant, the Viracid. And then we have our TLC multimineral, in which 3 capsules will give you 20 milligrams, plus all the other things like selenium and such. Quite a wonderful product. We have by Orthomolecular the reacted multivitamins, in which they have 6 milligrams of zinc, but again, they have all the wonderful multivitamins, the selenium, the magnesium and such. And then we have our 2 multivitamins, Mitocor by Orthomolecular and ours, in which they both have the zinc in it at a level of 5 milligrams in each, as well as many, many other immune boosting components with the vitamin A and such.
And we skipped the reacted zinc as well.
And then the last item is the Orthomolecular is just reacted zinc. This is the highest dose. This is a 54 milligram per capsule, which is very, very high. Well, I don't want to say it's too high. I would say if you're on 100 milligrams a day for several weeks, you could upset your copper zinc balance. But taking this, if you think you're coming down with a cold for 2 weeks, one a day is probably a very fine and safe thing. However, what I've done and endeavored all these decades of my practice is to get my patients always on a multi-mineral supplement that has the zinc in it, and teach them to be low carb, and always tell them to drink water and not to eat late and to get a good night's sleep where your immune system resuscitates. So these are our zinc items, but we have so many because
they're hard to get right now.
They're hard to get, and this just begs the fact that we're all getting healthier finally. It took this to shake everyone up, to say prevention is the right direction to go in.
I have a question about VitalZyme. How many for the less potent VitalZyme do you recommend? Again, this goes back to supply chain. Our go-to is the VascuZyme,
right,
that has the serrapeptase in it, the great systemic enzymes. That is, because of supply chain issues, now impossible to get until probably May. So we've gone to our old go-to, which is VitalZyme, but it's very expensive. There's VitalZyme XE, but they do have a lower dose strength.
It's half strength.
Half strength. So how many would you recommend?
Well, theoretically, because it's half strength, you would take double the dose, whatever you were on your
full strength.
Full strength VitalZyme XE and VascuZyme. And I would just say, everyone, if you're past the age of 40, you probably should be helping yourself with some enzymes every morning, 3 enzymes on an empty stomach every morning.
Okay. What kind of magnesium supplement is best to use, and is there such a thing as too much magnesium?
Too much magnesium can lead really to being fatigued and diarrhea, things like that. I have never seen any toxic, life-threatening issue from that. We like using Orthomolecular as a company because their integrity in choosing their sourcing is chelated magnesium. These are amino acid chelates that allow the passage through the membranes, the bilipid membranes in your gut. So we use magnesium chelate. Magnesium such as magnesium glycinate, magnesium citrate, magnesium sulfate. These are largely chelated from Albion. Albion is a company that does the chelation forms.
Okay.
Chelated forms.
Is 50 milligrams of zinc gluconate a proper dosage?
Yes, it's a higher dose, and I don't think there's anything wrong with using 50 milligrams of zinc glycinate, for a month. But then after that, I probably would cut it in half and maybe only use it on odd days. I've never seen a problem with anything above 25 milligrams. Getting it to 50 is on a prolonged basis can upset your copper balance. But again, where's all the research into nutrition, and why don't the doctors, as a general rule, be required to understand nutrition and teach this so that they can help prevent disease?
Is white willow bark and or arnica safer to take for COVID-19 fever instead of Tylenol or Advil?
Unless the fever is very high and debilitating, I wouldn't treat it. Okay?
And what would you say is a high fever that starts to concern you?
I would say 104, 105, definitely.
So below that, monitor it, let it run its course.
Right. Drink plenty of water and rest. The white willow bark is, I believe, a source that mimics aspirin as an anti-inflammatory. And so I don't know that I would go and take anti-inflammatories for this, like ibuprofen and such. I would rather just manage the fever. Fever was designed to stimulate your immune system to help fight viruses. So unless your fever is prolonged day after day at 104, and you're getting delirious and not drinking enough, then I would certainly address it. But fevers are good. Fevers are helpful as long as you stay hydrated and alert.
Thanks. We're getting lots of affirmations and thank yous. We appreciate that, guys. So I'll pass those on to the doctor. What are symptoms of too much inflammation in the body? Is rheumatoid arthritis a symptom?
Rheumatoid arthritis is a name of a disease complex in laboratory that identifies a inflammatory process attacking the joints in a specified pattern of presentation. Now, we believe all these inflammatory processes are largely gut related, and so the injury that first has to happen to a human being is the barrier is being broken from your mouth through to your anus, and that injured one-cell membrane needs to be repaired. So we here at TLC, with our integrative approach, deal with phospholipid replacement therapy in all the things that we do, especially gut repair health. We use enzyme therapy, systemic enzymes on an empty stomach as our anti-inflammatory. We push a lot of water. We stop and remove the food irritants that will create some of this damage here with food allergy research on that and considering your blood type. We also use replacement, such as the phospholipids and the probiotics and the such. And hormones help bone joint repair. So we have a whole series of things that we do when we look at you to address these multiple presentations. So rheumatoid arthritis is a name of a disease defined by a pattern of presentation and laboratory data, but many people can be subclinical. So I am so blessed to be going to be 66, and I have no arthritis. I have no medical problems at all. I'm just so blessed. I sleep like a baby, but I'm on my hormones. I drink my water. I don't eat late. I do, when they don't restrict it, I'm at my Pilates multiple times a week and my perfect workout multiple times a week. I take my enzymes. I take a core amount of multi-nutrients and minerals. I take my enzymes. And I think that this, along with edeticulation to improve my microcirculation, I hope I answered that.
I think you did, and correct me if I'm wrong, but the question being, what's a sign of too much inflammation in the body? Well, I would say disease, because the root of disease is inflammation, right? So that disease could be rheumatoid arthritis, or it could be cancer. I mean, inflammation is a natural process in the body, but when it gets out of control, when we're assaulting our GI tract with foods that we're not doing well with and eating too many carbs, that's when the scale tilts into the bad type of inflammation, too much inflammation, and we put a burden on our body that can manifest as disease.
Right. Okay. You know, our whole immune system is designed to use a certain portion of the inflammation to target a infected cell, kill it, destroy it, blow it up, and then enzymes consume and vacuolize and remove the debris from these things. So there's a place for inflammation. And as Talon mentioned, Talon graduated medical school with me. I was 8.5 months pregnant, so he graduated medical school and heard all the training during his development. Right. So I like to talk about that.
I think we're getting close to running out of time, but I think there's 2 questions that we should try to get to real quick.
Sure.
One, because they asked it last week, I'm not sure we got to it, and the other is, I think, a quick answer. One person's asking, while we are being asked to stay home as much as possible, would you say it's safe to come to TLC for an immune-boosting IV?
Absolutely. I would in no way tell you that denying yourself immune boosting behaviors would be a detriment. As I look at this, I still think the risk is low. I think the problem was our failing immune system from our lousy standard American diet and the trauma we've done to our immune system. And so definitely, please do come in for that. And what was the other question?
And they asked this last week, and I don't think we got to it. So they just asked, please, how does the virus get into the body? Thank you.
Well, it's usually you're touching this from someone if you're in contact in a sustained amount of time, or you're close with them, and then you touch your face and oral areas. This is the understood mechanism. This aerosolized concept is not as well favored as compared to the fact that you're in a sustained closed environment with something for a prolonged, say 30 minutes of time, and touching, and then you touch your face and so forth. So it gets into your body, and your body is designed to fight this off. We know that our bodies can do it because we have 80% at least, if not more, of the population that is doing without any treatment at all just fine. So we're designed to focus on these things. And so why don't we put more research and conversation at these meetings on building up the immune system? If 80% of us are doing much better without any need for care, why aren't we talking about the system that was designed to deal with viruses all the time, which is your sleep, your water, your sugar, your exercise, vitamin D, sunlight, and all these kind of things?
Well, thank you, everybody. We're just about over time. In fact, we're over it. I've got to get the doctor to her first patient in the morning. But I want to thank you so much for joining us. And we're going to look back over the questions this week, because I know there were some questions we didn't get answered. We'll make sure that we give those priority next week. Join us early. We're going to start the video a little bit early so you can start asking questions a little bit earlier, and we'll focus more on answering those questions. And if you do subscribe to this channel and we do a video before next Wednesday, you'll get notified of that, and we'll of course bring it up next Wednesday as well too. Dr. Althorpe, I know, has a couple things she wants to speak more on, so maybe we'll get you on camera and talking about some of these and answering these questions.
Maybe we should change the date from Wednesday mornings, when they do all the yard work here and all the yard work in the morning at my house, and then my nose starts to run.
She's not always sneezing like this, but yeah. Well, thanks again for joining us here. We will, in the very least, be back here next Wednesday at 9:45 a.m. Pacific to answer your questions live. Thanks for joining us. Subscribe to the channel, like it if you appreciate what we're doing here, and we look forward to answering your questions then. Thank you.